This one thing cures 90% of low back pain. I'm talking muscle pain, joint pain, disc pain, 90% success rate. And I'm going to tell you exactly what it is today. My name is Dr. Grant Elliott, and we have helped thousands of people around the world fully recover from low back pain, disc herniations, and sciatica through our one-on-one online coaching program. And in this episode number 131 of the Low Back Pain Podcast, I'm going to tell you exactly what helps cure 90% of low back pain. Real quick, if you have not joined my private Facebook group yet, you need to do so. It is called RehabFix Low Back Program. And immediately upon joining, you will receive our free step-by-step sciatica guide. This is the same process that we have taken thousands of our clients through around the world to identify exactly how to fix their sciatica and ultimately become pain-free through our one-on-one coaching program. In this group, you will be able to see our clients and what they're doing for success and additional resources and more free guides. So if you're serious about fixing your back, you need to join this group, RehabFix Low Back Program. See you soon. So what could possibly have a 90% success rate for lower back pain? 80% of people around the world will struggle with low back pain at some point in their life. And it's very difficult to find effective relief, right? The most common avenues are simply going to your primary care physician. They unfortunately are not trained in lower back disorders, and so are typically just sent you to a generic PT clinic or usually to get an x-ray, which typically doesn't show too much. They might tell you some degeneration on there, which doesn't really matter anyway, because degeneration is a normal age-related process. And they also might send you for an MRI, where they might see a disc bulge or things of that nature, which are also very common to find amongst imaging. And so then from here, you might go a few different ways. If you want to seek medication, you might go get medication, which is simply masking symptoms, as we know. You might go to a generic PT clinic, where you might receive some simple core exercises, glute exercises, some hip flexor stretches, stuff like that, which you may or may not see success with. You might go to a chiropractor, who could do a multitude of treatments with you. He might do rehab with you. He might do spinal manipulation. He might do decompression. There's a lot of different treatments out there. And everybody's looking for that number one treatment. And so people report all kinds of results going different places. Some people get results with PT and others don't. Some people get results seeing their chiro and some people don't. And this all depends on that particular provider and what they provide, because every provider is going to provide something a little bit different, right? But it's very difficult to find results. There's a reason why 80% of people struggle with back pain at some point in their life, and there's a reason why it's the number one disability in the world, because so many people struggle to find something that works, right? They struggle to find what works, and not many people see significant improvement with these typical old school methods of the general PT, the general chiro, the general medication. These are things that have been utilized for a long time that are not really working that much. Even surgeries do not have a significant success rate. Injections do not have a significant success rate. Injections in surgery usually have a lower success rate than conservative therapies, PT or chiro or things like that. But the big picture is still not that great for most treatment options. Most people do not see fast results with these. And if you're listening to this or watching this, then you're probably someone who's been struggling to find some results too, struggling to find something with a structured plan. So if you've tried PT and chiro and injections and even surgery and still not seen results, what could possibly provide 90% improvement, a 90% success rate with low back pain? Well, the one thing that successfully resolves low back pain in 90% of cases is time. Time has been found to resolve 90% of low back pain cases within the first 2 weeks. This applies to acute low back cases. Okay, I'm going to delineate here between acute and chronic cases and some other details here, but 90% of acute lower back pain resolves within the first 2 weeks. So, mind blown. Why do I bring this up? Why do I say it right now? Why am I saying this to you? There's two main reasons that I'm telling you about this today and why I'm making time, something that's free, such a big deal. Reason number one is to encourage you to not panic. Time can be very healing in the acute stage. I'm really emphasizing here that it is acute low back pain. Within 2 weeks, 90% of back pain within 2 weeks will self-resolve. So time is your friend in this regard. And this is going to encourage you to not panic. Because once again, 80% of people will experience low back pain at some point in their life. You do not need to be afraid of it. It is common. It is almost considered normal at this point in our society. So I don't want you to panic. Because if you panic when you are dealing with lower back pain, then low back pain gets worse. Things start to get in your mind. You start to get worried. You start to think about scary things. You start to Google scary things. And the next thing you know, you're running to your primary, you're running to the MRI, you're running to the orthopedist, and then you're being talked into surgery. This happens all the time. We hear this every single day, okay, from people who had an acute bout of low back pain, and they're really scared, which we don't blame them for being scared, but they just get funneled into the typical healthcare system, right? And next thing you know, it's been 4 days and they're already scheduled for surgery. It's like, oh my gosh, we need to relax. And I want you to not be fearful of your situation because you're not alone. Millions of people struggle with lower back pain and millions of people recover with the right path and the right plan. Now, the second reason I'm emphasizing that this is for acute back pain within 2 weeks is because I want you to know what to do next. Quick interruption. If you're listening to this podcast and you're resonating with the things that I'm saying and you're finally ready to be pain-free and you don't have a plan and you're not sure how to get there and you're just looking for that guidance, then visit the link in the description or the show notes below. You can schedule a free initial call with my team and we will actually go over your current regimen, go over what you should be doing, what you should not be doing, and how a better plan might potentially show you how to get to that pain-free state that you've been looking for so that you can get this over with and back to living your life. So if you're ready to finally figure this out, then visit the link below, schedule a call with us. Looking forward to helping you. Back to the show. Okay. If you are one of the many people where time does not cure you within 2 weeks, I don't want you to continue to rely on time. All right. This is also extremely important. Yes, time can be powerful. Yes, time can cure 90% of lower back pain cases within 2 weeks. But I do not want you to solely rely on time forever, because then you're going to find yourself in a situation that a lot of our clients have found themselves in, where not only has it been 2 weeks, but now it's been 2 months. Now it's been 2 years. And you're in the same situation, just hoping that something's going to be different. Time is not a cure-all in the long run. It is not a cure for chronic lower back pain. So if time, the thing that cures 90% of lower back pain, has not had a significant impact within the first couple weeks, then you need to start to take action. You need to be proactive so that it does not turn into a chronic issue and it does not get worse. So then at this point, you might pursue PT or chiro or any method that you feel you could be invested in at that time. And if you're not seeing fast improvement doing these, then you need to switch to something else, okay? Injections cover up symptoms. Pills cover up symptoms. Surgery has an upwards of 50% failure rate, okay? Repeat surgeries happen all the time. 30% of lower back surgeries are considered successful. 30% of people feel the same after surgery, and 30% of people feel worse on average. Okay, these are goal statistics for most surgeons. Okay, so I don't want you simply just sitting on your couch relying on time, because time and rest are not a cure-all in the long run. But I also want you to be aggressive about the routes that you do take. If you are pursuing a physical therapist or chiro or anybody else, and you're not seeing fast results, don't be patient. I encourage you to not be patient. You need to be aggressive with your expectations. For us here at RehabFix, we expect people to get results during our very first call. We expect most of our clients to be pain-free within 2 to 3 months. This is what we expect. We expect massive improvement fast. If you're not seeing that with where you're at, stop relying on time. Don't be patient, because you deserve to get results quickly so that you can get back to living your life, so that this doesn't get worse. It doesn't get out of hand. It doesn't start impacting your life or your career or your presence with your family or your friends. This is something that needs to be fixed. So do not become complacent with where you're at. Do not accept this pain as part of your life. And instead, stay calm. Allow yourself to breathe, relax, do not panic, do not freak out. It will only make your situation worse. But if you're noticing that after a couple weeks, things are not progressing significantly, then it is time to pursue rehab and corrective care. We post tons of videos on our Instagram at RehabFix. Go ahead and follow us so that you can see daily rehab exercises that you can start doing every single day. Start taking action. Invest in guidance. Invest in help. And if you're not seeing significant progress every single week with whatever path you're currently on, then you got to switch to the next path and try that. Switch to the next path and try that. And keep switching until you find something that is producing results fast and reliably and that they're lasting. And that's what's going to help you get to a pain-free life as quickly as possible. So I hope that this was reassuring to you, to comfort you, to not feel alone or scared in those first couple weeks after suffering a lower back issue, but also to give you an idea of the action steps and the game plan that you can set for yourself so that you can have a concrete approach to how you will manage your lower back pain and get your life back so you can be out of pain as quickly as possible. And we will be honored here at RehabFix to help to guide you through that process so that we can show you a plan designed for you and your current lifestyle to get you out of pain now, quickly, and that you can trust in every single week and you can see results as we go. So I'd be honored to meet you and to work with you along the way. Once again, be sure to join my Facebook group, RehabFix Low Back Program, so you can get additional exclusive content and our free sciatica guide immediately upon joining. And you can look at the additional upcoming content that we're created just for individuals in that page. It is a great way for you to join a community of serious, intentional individuals, and you can get to see some of our clients winning as well, so you can get a real idea of what is possible for you. If you are watching this on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and help reach more individuals who deserve to get results, who feel like they're spinning their tires and getting frustrated in doing so. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.